Hello, my name is Ben Walter with Rock Canyon Biomedical with the automated insulin pump. So the issue with type 1 diabetes is that when there's no insulin being produced by the body, there are two treatment methods, either by insulin infusion pump or by pen. Now the cost advantages with either of those are about equitable in terms of a payer standpoint. One costs about $10,000 per year from the pen, and the pump typically costs $6,000 to $12,000 depending on the pump. With the most recent device being the 670G from Medtronic, costing about $12,000 retail. So the issue with type 1 diabetes management is the consistency of the blood glucose staying in range. And so as a result, you typically see patients with those inconsistent blood glucose levels. They become sleep deprived, they become panicked when those blood glucose levels are in rapid change. They're lost in a haze, they're fatigued, and in cases where those blood glucose levels have been out of range for some time or to an extreme level, it does necessitate medical intervention, and in a long-term scale, it does require, or it does end in cardiovascular disease, or the chances of cardiovascular disease, neuropathy, and retinopathy. And so the current solution out in the market that's most approved by the FDA is the 670G by Medtronic with a retail price of $12,000. Now the issue is, while it does lower the A1C of the patient, there are still, as you can tell, very large variations in the blood glucose level. This was a person that we've been working with to compare the 670G with our device as well. And so that said, with our device, it takes a reactive device such as the 670G, which acts on current blood glucose data to then adjust the infusion rate of insulin. Ours goes through an external piece of hardware, at least in the proof of concept, that allows the blood glucose to be predicted and then insulin infusion rate be adjusted as a result. And so as you can tell, these are actual results from the same person with our device. And so you do see greater consistency in blood glucose, and so those symptoms, as previously mentioned, are vastly reduced. And so going forward, the point is to then take the external piece of hardware and to then put it into a single device to have the same configuration as the setup of an insulin infusion pump with a continuous glucose monitor. Now the market is, at least for our materials, at least costs about $87. So, and that's just with materials as opposed to labor and manufacturing going forward, because those are difficult to predict at this point. In terms of the market moving forward, we estimate, because of the cost savings that is analyzed by the infusion pump versus the pen, insurers have only issue about 500,000 of the 1.5 million type 1 diabetics with insulin infusion pumps. And so we estimate that with the retail price of the 670G, because it is the only hybrid closed loop system, we take about a $15 billion market valuation. So as a result, we do see, at least in our prototype, that there is greater blood glucose control, there's less time out of range, there are lower medical costs, and a lower cost of good as a result, hopefully opening that up to a wider patient range. So thank you so much.